What is the gospel? And what does the Bible really say?
What does Jesus mean when he teaches about the kingdom of God?
What part of American Christianity ought to be exported and what ought to be quarantined?
What is the proper motivation for missions?
What does the Bible teach about
agriculture,
education,
Sharia,
health and healing?
How is your worldview different from that of the Bible?
What if we truly put God first in clinical practice?
education,
Kuolewa.
What if we could really engage with our patients?
Ninajihisi.
Shame.
How do we discover the basic assumptions of a culture?
How do those assumptions affect health?
How do we bring about change, real transformation in people and communities?
How do we transmit biblical values to a fatalistic culture?
What does Christianity do to a culture?
How is it that in 1978, the World Health Organization made a goal of primary care for all, but in 2012, fewer people have access to primary care than in 1978?
Why are most medical missions limited to hospitals and curative care?
Kwani tunaegeza kwa vyuo lakini sio kwa watu?
What would Jesus say about that?
How can I find a spiritual mentor with whom I can speak honestly?
How does our morality affect the land?
What do improving the land and sending girls to school have in common?
What if we choose not to define poverty in material terms?
How have condoms really affected the AIDS epidemic in Africa?
Why have condoms become the mantra of AIDS prevention?
Do guns have a place in the mission field?
How is it that mobile phones have swept around the world in a decade, but after 2 millennia, the gospel has still yet to reach many?
This summer, a group of students and facilitators will convene in Ntagacha, Tanzania to wrestle with these questions and more. We will have discussions in the mornings and practical applications in the afternoons and evenings. Please see our website for more details and get ready to have your assumptions challenged.